Baruch here with genConnect and Dr. Diane Meier from Mount Sinai. So Dr. Meier, let's start out by asking a question that I know I don't understand, and I'm sure many of our audience members don't understand. What's the difference between palliative care and hospice care?
That's such a great question, and I'm really glad you asked because it's a place where most people remain very confused. So palliative care is a new medical specialty that's focused on maximizing the quality of life for the patient and the family while they are living with a serious illness, whether that illness can be cured, whether that illness is going to be chronic, something they can live with for a really long time, or whether it's a progressive disease. Hospice is a form of palliative care that is limited only to the dying. So it's a Medicare benefit that other insurers also cover that has restrictive rules to try to keep the costs down, basically. And it says that people can get hospice if they are within 6 months of death and if they agree to give up treatment for their disease. So as you can imagine, we have no idea who's within 6 months of death, no idea. You know, some people that I think might be dying in a month live 3 years.
Right.
Some people that I think are going to live 3 years might not make it a month. It's not predictable. We just don't have that ability. So palliative care grew up to fill that gap that hospice couldn't fill, for people who needed help with pain and symptoms and stress, who needed support for the family caregiver, who really is the linchpin for this whole game, and who needed people who would help them understand what to expect in the future as disease progresses, what their options are and their pros and cons, and would answer their questions honestly and try to help them achieve the goals that are most important to them.
So really the emphasis is on living rather than dying.
Yeah, the emphasis is on getting those extra years to be worth having.
And so at what point does one start to implement palliative care as they're going through the cancer treatment?
Right, so that's another great question. And also addresses another important misconception, and that is that it's either disease treatment or palliative care, and that's all wrong. The right conceptual model is that when you are diagnosed with a serious illness, whether it's leukemia or lung cancer or heart failure or dementia, that from that moment on, you need both disease treatment, for example, from an oncologist, and palliative treatment focused on you as a whole person, your family, and the things that matter most to you. Examples are, we take care of people who are the primary breadwinner in their family and can no longer work. And their biggest worry is that the support of their family, the financial support of their family. How are they going to manage? We help with that. Or we have patients who are frail and in their 80s or 90s, and the only person taking care of them is their spouse, who is also in their 80s or 90s and is exhausted and stressed and overburdened. And providing help and support for that caregiver is what enables that patient to stay on the planet and have a reasonable quality of life. And so it's paying attention to the person beyond the disease while at the same time assuring appropriate disease treatment.
Dr. Meier, thank you so much.
Does that make sense?
That makes a lot of sense.
Okay.
I get it a lot more, and
Okay.
it was a 3-minute conversation.
Yeah, there you go.
And for more with Dr. Meier, be sure to check out genConnect.